we're going to get to the business of business. Ladies and gentlemen, Dr. Anna Brown
Dr.
is here
Brown.
here to talk to us about what she's doctor about and what she thought of and what she made and now what.
And now what? Yeah, the business of bismuth, actually, which is, I thought that's the pun you were going for. So
Who's barking in the background?
call them trouble and substantially more trouble. It could be anything. Sometimes it's a tree in the front yard.
Is it one animal or multiple animals?
2 animals and a toddler.
What are the names of the animals and toddler?
Kiki and Oscar are the dogs, and Minerva is the toddler.
Minerva, wow.
Yeah.
I had an Aunt Minerva.
You know, it's funny. You never see any kids named Minerva, but my neighbor, who's a grandfather, says when I told her what we named her, because my mother's name was Minerva.
So is it a family name or you just thought it was really cool?
Both my husband and I studied the classics in college, and we wanted something that was, strong, feminist, blah, blah, blah. I had to talk him very substantially out of naming her Maxine Iris Noble, and her initials then would have been Max and Min. He thought that was just like the funniest thing he'd ever heard. He's a mathematician. Anyway, Minerva and her initials are Min was the kind of compromise.
Does she go by Minnie?
No, we call her Minnow.
Okay.
Minnie is a little diminutive, so.
Sorry, I didn't mean to offend.
No, it's fine. It's, I guess, the standard nickname for Minerva, but
people are chomping at the bit now. Joe, please, can we start the program? What did you get your doctorate in?
Sure. So I'm a chemist. My doctorate is in synthetic nanomaterials, and I did my postdoc in nanopharmacology. So developing I actually worked on now everybody's heard of it, is the lipid nanoparticles for mRNA delivery. So basically what Moderna has and Pfizer have turned into our saving grace. Actually, some of the work we did was licensed by Moderna. I get a check from them every once in a while.
Nice.
Great. But I came back.
Who were you with when we worked on that? It wasn't just you. When you get a check, you were part of a group?
Yes. Sorry, this was my postdoc group. That we did some research into alternative cholesterols and alternative lipids for those formulations. I don't think they end up getting used in their actual formulations, but they did license the technology.
Okay.
Yeah. Anyway, the research and I'm going to show you many, many years down the road of what the final product has become from. It's actually my graduate research. So this was something we patented when I was in graduate school, and then spent a long time hunting around for various applications. This group might be sort of interested in some of those very, very random applications that we hunted for. But if it's okay to share my screen.
By all means, go right ahead.
I'm going to give you guys just a quick rundown. What I'm really interested in from this group is looking at it through the eyes of marketing. And I'm a chemist. I'm really comfortable in the lab, really uncomfortable putting together marketing devices, selling things. But as a CEO, entrepreneur, I got to figure that out or figure out at least what direction I'm going.
Which is precisely why I invited you today, to meet my friends who are smart in lots of things.
Yeah. So this is very much a soliciting feedback kind of, or thoughts, ideas. You guys probably know the medical, well, I'm sure you know the medical marketing field better, but actually some of these use cases you might even know better than I do. So love to hear your feedback. You'll see in a second why this is sort of raw, and I'd love your thoughts. Okay, let's try this. Shoot, sorry, this is going to take me a sec because apparently I have to change my settings. I don't know. Do you have any questions or thoughts off the bat? I know it's a little ridiculous.
Yeah, everyone's question is, so what do you do?
Yeah, well, it's radiation shielding materials. So you think of those lead aprons you have to wear. We're making a better one of that, and I'll show you what that means.
Would you call this category a garment?
Yeah, absolutely. And it's odd because it's not just a garment, but it's also it's a fabric that enables us to basically make whatever we want. So think of like what Lycra and spandex did for yoga pants. So it's elastic, it's flexible, it's modular, it's sterilizable, it's you can fold it, you can drop it, blah blah blah. Why I am not.
Do you want to send me something and have me project it?
Yeah, that's
Is it
probably
a website? Is it a PDF? What are we looking at?
send you a PDF. Let me just drop it into
Should
it.
we play the Lonnie Donegan song while we're waiting?
Sounds great.
Okay, I'll share my screen and we'll do the Lonnie Donegan thing. Let's see, let me shut this. Technical difficulties, folks. Sorry. Okay.
Okay, it should be in your email now.
Email or Slack?
Email.
How archaic. Did you send it to me at Medical Marcom? I'm sorry, folks. Did you do it to Medical Devices Group?
Medical devices.
Okay. All right, talk with us while I'm calling that up.
Sure. So where we're at is we have a fabric, right? We can produce this stuff in any shape, any size, any radiation attenuation, right? If you guys are familiar, they come in 0.5 millimeter, 0.3 millimeter, 0.1. We've been looking at a couple of different applications, but I've really settled on medical as a market because there's such a strong need, particularly in the fluoro suite, for having personal shielding garments that enable surgeons to move, enable them to protect other things. Okay, so here's a quick shtick. The company is called Stark Street Materials. I'll tell you what my working branding name for the actual material is, because Stark Street Materials is kind of a generic name.
Does Stark mean anything to you?
Yeah, I live on Stark Street, and there was a previous startup based on this technology that was the next street over. So when I had to pick a name, I had to pick something pretty generic, and so street I live on. Okay, so I assume most of you are familiar with these. You've probably had them at the very least in the dental office. I've heard a number, and this is sort of secondhand, that a number of particularly device reps, when they travel around and go into operating rooms, put these on, or you have your own. Very curious to hear your experience with these aprons, and in particular the thyroid collars as well, whether you use them, what are the issues, blah, 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 because we're looking at thyroid collars. So the question is, cracked a problem for radiation? It's so at hospitals, the radiation safety officer is required to track, monitor, and at least keep records of every piece of lead shielding in the hospital. So what that typically means is once a year there's an audit where somebody goes through and they feel the apron. If they feel anything that might be cracked or broken or whatever, then either they get rid of it or they go and x-ray it, which is a whole bunch of extra fluoroscopy, to see if it's, or to visualize if it's damaged or not.
Sorry,
So
what's fluoroscopy?
fluoroscopy is real-time x-ray imaging.
Thank you.
So in when you hear the term interventional cardiologist or interventionalist, I think most orthopedic surgeons use it. Most urologists use it. Thoracic surgeons. It's basically it's a C-arm. So it's got this big machine. X-rays up here. You're sitting here with your patient doing your surgery, and there's real-time X-rays coming down through your patient, so you can sort of see what you're doing, how you're poking them. Anyway, everybody in the fluoroscopy suite has to be wearing radiation. I guess it's technically depending on the state, but I believe the Joint Commission has an outline for a lot of these things. I've recently been reading about different states' regulations around radiation shielding. Idaho, kind of a like, do what you need to do, buddy, state, which is terrifying. Anyway, so there's a lot of issues with these things. It's very old, outdated technology. Next slide.
Mm-hmm.
So I've collected a lot of consumer input. This is actually a quote from a paper, an academic paper, but the problem is that these things are so heavy, unergonomic, and difficult that they prohibit people from doing their jobs and actually cause musculoskeletal problems that force people to stop working. So I have one surgeon I've spoken with. He's young, he's healthy. He actually had to stop his job, stop working, take medical leave because the lead shielding had created so many problems for him. My father-in-law is a urologist at the Cleveland Clinic, and he also, I don't think his initial back damage was from these lead aprons, but his orthopedist said that it absolutely exacerbated it over the years, and he's had to stop working because he literally couldn't wear the apron.
And he wrote in the comments he already knows a customer for you.
Great. People, because I'm sort of heavy into pitch mode and developing this, when I'm looking for are, quotes, people who can say like this, I will throw money to solve this problem. But yeah, I know it's a problem. I know that it's a really big issue.
I would think I'm not a huge fan in general of crowdsourcing for medical devices. I know it has worked selectively, but I would think this one could be a candidate for it. For like Eddie's friend, for example, and I'll bring him on. It's screen sharing, and I only have one screen today, so it's a little more difficult for me. Dwayne, it doesn't need to be now, but if you can, what are you raising? How much are you trying to raise right now?
$650K, and that's going along with a NSF SBIR phase 2 of 1.1 million. And I believe between the private equity raise and the NSF pot, that's enough to get us through to market.
You threw acronym at us pretty fast. NSF BIR.
Sorry. This is where my science starts showing. The NSF is the National Science Foundation.
Okay.
And so they tend to invest very heavily in science technology startups. And
that 100% of your fundraise so far has been grants?
Grants, yes, but not the NSF. The NSF is about the SBIR, the Small Business Research Grant we're working on is about half of what it raised, but everything is grant funding so far.
Eddie, you commented.
Anna. And I'm based in the UK. I know a reasonable bit about this area because, like I say, this good friend of mine is. I don't know if he's still practicing anymore, but as you were describing your father, anybody who's doing minimally invasive surgery has always got to be wrapped up in this stuff, and it just destroys their backs. So. I can easily understand. So, is your background? Are you a physicist, or how did you come to this thing?
So
I didn't catch that.
I'm a chemist, and what I invented as a graduate student was a way to use the element bismuth, which is the element next to on the periodic table, the lead. So it's got a really good X-ray attenuation cross section, but it's non-toxic. So Pepto-Bismol is bismuth. People drink grams of this stuff pretty regularly. So we know that it's very, very safe. And what I developed was a way to chemically stabilize bismuth particles. So the reason nobody's ever done this before, because we know that bismuth is a good X-ray attenuator, is that it tends to fall apart. Like you take a bismuth particle and you mix it into a polymer, and it tends to fall apart during the chemical processing. So if you can stabilize it as you form the particles so that you can put a coating on it, it doesn't fall apart, and you can make these really high density composite materials that are excellent at blocking X-rays.
Fantastic. I actually used to run an X-ray sterilization company that I was trying to get going, and this type of shielding actually would have been really good in that, but that's a different story. So.
If you can do it in a sentence, what was the problem about getting that one up off the ground?
Getting the money. It's always about that. We had loads and loads of applications. The last one that we ended up on was actually the problem of sterilizing like stem cell organs. Stem cell organs are actually grown onto a scaffolding of harvested from another species, usually a pig or something like that. But that then has to be sterilized in between. To do that with gamma radiation or any other existing thing wasn't going to be good enough. But anyway, that was.
So you were using, that's interesting, gamma radiation. I guess you're just sterilizing the scaffolding, not the actual bio.
Yeah, You have to harvest the scaffold, then sterilize it before you introduce the stem cells, and the stem cells then grow on through the scaffold to effectively make an organ. But the simplifying it even further, as Joe was saying, is basically taking the idea of a mainframe computer down to a mini computer in terms of sterilization.
Yeah.
So it can be on site and on demand. Anyway.
Interesting.
Thank you for that. I invited Rob on. I guess he's multitasking. He can't, but he wrote that class 1 devices with no design controls or 510K just need a quality system, could be crowdfunded without conflict from FDA. Did you know this?
I've recently learned about what my FDA regulatory obligation is, and let me tell you, that is good for business.
Okay.
Yeah.
I mean, aside from medical applications, I'm sure there are a whole bunch of disaster prep folk who would love to have this in their bunker.
Yeah, so I call that my tinfoil hat market, because let me tell you how many people have asked for like a hat or underpants or, something they can just put over their bed. And, on some level, it's like, yes, you're blocking radiation. This is non-toxic. It's very clearly a market, but do you need it? It's really hard for me to say, like, you need this because it's good for my business.
Yeah.
I'm still kind of stuck on the bismuth underpants. Can you?
Yeah. So people, this came up when I was doing some marketing in hospitals who work with radiation, particularly men who are trying to get their partners pregnant. They are paranoid about X-raying the important organ there. And so I got multiple people asking me for underpants. And
Thank you. This is a family show. We appreciate that.
Yeah. I'm trying to learn to watch my language now that I have a toddler and, she's absorbing everything. But underpants, I get asked for it all the time.
Getting back to the science side of things,
Thank you, Eddie.
What's the relative weight ratio for the same level of shielding you would have between lead and your product?
If you're comparing directly bismuth to lead, it's same weight for the same amount of shielding.
Okay.
Potentially a slightly bit less, but we're still validating all those. Basically, you can think of lead and bismuth as having the same weight attenuation profiles. They're right next to each other. We are developing a lightweight alternative as well. So the technology that goes into that is you mix in a couple of other elements into the product, and we're going to meet or exceed the current lightweight shielding. So like if you're familiar with Xenolite or a couple of other alternatives out there, I think Infab just made up their own one. We're going to meet that. Where our product is different and where it's going to be 10 to 20% lighter than the current lightweight alternatives is because there's no fabric that goes into this. There's no stitching, there's no sewing. It's that image I showed you of the flexible material. That's it. So it's stretchy, it's elastic. You can stick it in the sink and wash it with soap and water in between. You can autoclave it actually if you need to. We're going to do the gamma radiation testing next week. I just hired a nuclear scientist and he's so excited about going down to Oregon State University and using their gamma radiator.
Well, since it then wouldn't have to be covered in any fabric, it would also logically be much easier to determine whether or not it has failed, as in rips and tears.
Exactly. So I've got 5 strong value propositions related to this stuff, like why somebody would buy it. I don't know which is the most important one when I present it, starting with an investor being like, here's reason 1, here's reason 2, here's reason 3, here's reason 4. They don't particularly like that because it feels like you're kind of compensating, but I don't know what is the one reason that everybody's going to be like, here's the money, give me your.
Let me tell you, there isn't one. The best thing to do is when they get telling you what your most important thing is, then you've got interest. Because when they start selling you your product, let them keep going.
Great. You know what? I love that.
Elizabeth, I haven't seen you in a while. How are you?
I'm great, thank you. This is very exciting to learn about Anna's product and this piece of the journey that you're on. I'm on my own journey. I see Michelle's on. Hello, and thank you for all of your great work with one of my products. I have several radiation, first of all, radiation oncology world people, which is different than interventional radiologists, but I do have two different people that I'd like to introduce you to who are radiologists who are interested in business. And they would be, I think, very excited to meet you and to learn about how they might be able to participate with you in this. The other very strange piece of my world, I have a fabric company that's 100 years old. And it's just a little piece of my history that I haven't shared with anyone here in this group. So I inherited this business. It was my grandfather's. And we still sell some fabric in the automotive industry that has nothing to do with this, what you're making, but it is a whole fabulous, expansive world in specialty fabrics. And I'm happy to share that, of course, offline with you.
That would be fantastic.
It's unbelievably exciting and interesting.
Yeah, I'd love to hear more, and I'd love to hear about small niche fabric industries.
It's really wild.
We have, I'm in the Pacific Northwest when we've got Adidas, Nike, and all these other here. So there's a lot of the sportswear fabric. So I've learned a little bit about the fabric world, but those are not small niche.
No, I understand. But this whole piece with the radiation world, well, anyway, the part that you're going after, I think, is very exciting. I happen to also know a pathologist who came up with an idea to have a conveyor belt to hold these heavy aprons on. This is about 20 years ago. She was never able to commercialize this. Her husband's a cardiologist, and this was 20 years ago when he was, all of 35 years old, having back problems from these heavy aprons. So you're right on target, and the new generation of physicians coming out and practitioners, all kinds, will welcome this product.
Yeah. There's a couple of products that are sort of like along that line. Like there's the zero gravity, where they have a bar that attaches to the ceiling and these like drapes. And the feedback I've gotten from those is that, some surgeon who has back problems insists that the hospital installs them for $100,000 because it's such a big problem. And then they don't get used because, what surgeon wants to be strapped into the ceiling? So
correct. Anyway, you're really onto something that's very exciting. Happy to help any way I can.
Great.
Gone ahead and given you direct links to everyone you've spoken with so far on Slack, so you can follow up with them. Dwayne is next, but everyone must take note of Jan's over effort here to celebrate Sunday's coming Halloween festivities.
Another one of my champions from this program, Jan. So thank you.
Dwayne, you had a comment about crowdsourcing.
Yeah, just the caution it. I mean, it's something that's definitely doable. And I put a link in here for, his name's Kelly Roman. He just raised $2 million in using crowdfunding as a med tech startup as well in like 48 hours. But just be careful.
What's
and make
his
sure
value prop? What? I mean, that's just not.
Yeah. He was on the podcast. There's a whole, I forget what his company does, but anyways, he just released the information yesterday. Anyways, Red Crow is a health tech crowdfunding company that's out of San Francisco, and they understand they understand how to do this, and still that way you're able to take on follow-on investment, because there are stories of taking crowdfunding which then screws up you taking additional funding later on as you go. So just be aware of these things from an early onset. I think there was another guy on here that talked once about this out of New York.
Alex Fair. I'm just
Alex
writing.
Fair. Yep. He can help you with that. So just be aware of those things. And I think from a value proposition side too, it's very clear the doctors need this. Just make sure you understand who's actually paying for this and who's going to buy it, and what's your proposition to them, right? I mean, because at the end of the day, doctors can influence a hospital system, but I've also seen scenarios where it doesn't matter if there's 50 doctors in the hospital system who need something, they're not going to do it unless it makes sense from an economical standpoint. So just words of advice, and also coming from a fellow chemist. So it's exciting.
Chemists Unite. Michelle, I brought you on because Rob had written how really quality management system is pretty much all you need for her business. What would you look for in a quality management? I know you have a template that we worked on, socializing. Would you talk a little bit about that?
So for the quality management system, you're going to be exempt from design controls largely if you're a class 1 device, but all the other things still apply. So it's still a pretty big lift to have just a quality management system. because not only is it having the quality management system, those are living, breathing things. And there are, internal resources, ongoing administrative management reviews, internal audits. So it's definitely not just something you get your quality management system so you can check your box and put it on the shelf.
Yeah. I've got somebody setting me up with a full charter document when I need to have to go to market, and he's very conservative. So he's.
And what are you going to be doing your own manufacturing, or are you going to be using a contract manufacturer?
We're going to be doing our own manufacturing. I think at this point, there's just so many weird components to it that I think it would be more trouble to try and get somebody else to do it. It's a very, very scalable technology. So having a facility that just makes it and pushes it out. Yeah. Anyway, I'm right in the middle of figuring out what the whole QMS
may be helpful for that, but we're going to jump to Jan next. Jan, you had a comment.
Thank you for your.
Since I just moved to the Portland area myself, I joined a biotech group that works with startup companies and helps them learn what to do with funding and stuff. They actually started out of the University of Washington in Portland or something like that. And I wondered if I'm not clear on all the names around here yet. I haven't been here long enough. But anyway, I have been going to some of their happy hours and enjoying what they're saying about that. And I wondered if you had joined that group to learn anything.
Is this out of OBI?
OBI. Yeah, I think that's it.
Okay. Yeah, they're the, are they virtual happy hours?
Yes. But they do have meetings eventually. It's just COVID has sort of brought everybody to these virtual things right now.
Yeah. Yeah, no, if it's something other than OBI, I'd love to hear it. I do go to the OBI happy hours sometimes.
I haven't seen you.
I haven't been in a while.
Okay.
But I used to a lot.
Yeah, I believe that's what it is, but I have been impressed with some of the stuff they do. Of course, I'm a packaging engineer, so if you need help packaging, that's what I do. So.
Could you talk about what do you think a packaging challenge would be for her? I'm thinking it's a garment.
Weight,
I know
the weight that she's talked about. If we can fold it, if we can do those things, we could probably get it down to a small size for shipping, but it's going to be heavy, which is going to cost you more. So you want to keep your air volume down, but I don't know how much trouble it would be to poke a hole or anything like that in there. So I'd have to understand that more, because especially heavy boxes can get holes punched in them a lot easier than lightweight ones. So you have to see how that all fits together.
I'm inviting Michelle back on, and perhaps we collectively know the answer, but Michelle, would you say that Anna's device is a medical device, and therefore my one thing I always remember that Jan taught me was medical devices packaging is the medical device. It's not the box, it's part of it. So
yeah. Well, especially since most class 1s are exempt from design controls, people think that means that they're really exempt from testing, like packaging and whatnot. But then the next thing you know, if you don't use somebody like Jan, you're going to have, complaints and product problems. And then you're going to have to retrospectively reverse engineer your packaging.
I'm having trouble with a company right now who's not going to put a shelf life on their product. And I'm going, don't you want to know when your packaging falls apart and has some issues out there? Even if your product doesn't need to be sterile, it can't get contaminated. So we're working through those issues right now.
do you have any thoughts right off the bat? You hear that Anna's working on a garment of this nature, like a make sure you blank, blank, blank. Do you have anything like that, Jan?
Oh, well, learning what damages the product and how much protection it needs. It's hard for me to say until I actually hold the product and see it and stuff, but.
Well, I put you two together as well. Anna, have you given any thought to packaging yet?
Not really.
You start in the beginning and I can help you optimize the shipping costs and stuff. But if you bring me in when you say, oh, we got to ship this, you might have decided on certain graphics, certain ways of doing things that it's going to cost you an arm and a leg more to ship it. That's part of one of the reasons you bring in a packaging engineer first. And then they can just come in and begin and give you little guidelines and then disappear for a while until you need to
You can
actually
do
ship.
worse than hanging out with Jen for a half hour. Paul, I know you have a lot to add here. Go ahead.
No, not much to add. Just a comment. First, I love what you're doing. My wheels are turning. I'm a marketing guy and a logistics guy. If you have any questions further down, sales really, not marketing. Joe's the marketing guru. But the thoughts I was having, because you were saying you were waiting for people are not giving you money. And I just want to make a distinction for you to hold that idea. And forgive me if I'm being rude or presumptuous here. But I spent a lot of time with the investment community. And so when you talk about the conversation so far has been a lot about the material, because that's where you're coming from, and the science and the technology and stuff for that. But I was writing notes. I'm like, heck, if you don't want to talk about how powerful, how useless it is, or how inefficient it is to protect my manly parts, I'll say that to the people. Don't worry. If there's a market, give the customer what they need. So when you talk about the value of what you're doing, if you are based on your audience, if you say, I'm not presenting for the sake of getting a check, even if it's for crowdfunding, speak in context almost at least 50-50, if not 60-40, if not 70-30, greater number on just the market fit. Because what works for a surgeon may not work for a dentist. And I don't know, I'm not those marketing experts, but what works for the dentist won't work for the tinfoil hat guys.
Mhm.
But there's always a market. Those are all markets, and you got to decide which products go where, what is your brand. And it can be, crawl, walk, run. You could go to market first, but talk about specifically, hey, for, in quotes, dentist office, for the hospital market. And then what happens is the listener and the investor will start making connections on their part, and from their already listening from a practical psychology standpoint.
Gotcha.
Right? Because I think that's critical. Make the technology narrative, lay that as a foundation from which you're building up, but very quickly go into the value in the market and if you want to raise money from your audience that you're speaking to, and say, this is how big that market is, and let them make those assessments of value. This is the specific market that you want to go after, phase one. And then when we hit a threshold of value, we might open up other markets. Oh, by the way, it actually scales. And the least scientific market is the tinfoil hat market, which is actually 6 times bigger than everything we've talked about.
Okay.
As an example, right?
Yeah. Well, you bring up an issue, and Joe, actually one of those slides on the market size,
Okay.
that this is one challenge I've had, particularly with fundraising, is that the market size for the shielding garments in the US is really small, right? 50 million per year. That's not very exciting to investors. And I've really struggled with how to describe the opportunity, because it is kind of a fragmented market.
Kevin, I see you're not able to join us by
Okay.
video, but I've given you access to speak. You had a comment about market sizing.
No, I kind of want to see what she had, a comparative, efficacy data, kind of, weight by weight compared to traditional stuff. And as I put in my note, I actually reached out to Anna already. I've got some questions for her on the business side. I told you, Joe, a couple of weeks ago, we kind of just went through this. We're actually in the middle of, I'm hoping, a pretty good exit from our technology startup in PPE. So it's kind of, I might be able to give you some thoughts on that if you've got some time next week.
Yeah. What kind of PPE?
We've got a antimicrobial polymer product that we can do spin into fiber. So it's going into nonwovens, for disposable PPE.
Very cool.
By the way, before I forget, Anna is going to be at 10X in May, so a lot of you folks can meet her in person then. Yes, Paul?
So responding to your $50 million comment, is there a exit strategy that you think is possible where you could prove your space, right, in the $50 million market, and then sell the technology, since it's already part of your DNA with what you did with Moderna and people like that, spin the technology and sell it, because an investor would be really excited about that exit. You don't have to do it all yourself.
So the couple of exit strategies that are available, particularly for the medical shielding, right? There's kind of a lot of other applications, like we haven't even touched on nuclear or defense, but this is very,
Sure.
we're pretty focused on the medical. One exit strategy I'd sort of toyed with the idea is that the manufacturers of the C-arms of the X-ray fluoroscopy, because this material, you're going to be able to print whatever you want on the front of it,
Yeah.
put whatever branding, logos, yada, yada, that if you're selling the fluoroscopy equipment and you know exactly who needs these radiation shielding garments around the country, and if you put your branding, your logo on it, that may be incredibly valuable.
Right.
To owning that particular technology. The other players in the radiation shielding market are absolutely not big enough to, it's possible they are. Infab in particular was recently acquired by an investment group. So it's possible that they may want to take this, but it's a small fragmented market, right? There aren't any one single players. There's about 20 big players in this market. And I plan to put them not all out of business, but basically the way these current shielding garments are designed is just ridiculous. They can't be cleaned, they can't be sterilized. So you have these incredibly contaminated woven fabrics that go into the operating room all day, every day.
Anna, with the team we've assembled here, I think you're shooting too small. You
Exactly.
do need to put them all out of business.
Thank you. I was going to say that. I mean, forgive me. I wrote the book. Tell them the market has changed. Have you?
Really? A shameless plug at this point, Paul? This isn't your week, man. Come on. I'm embarrassed for you. Where's your hat?
It's out there.
I thought you said whenever you got on with me, you would have the hat within.
Yes, I should, right? Mea culpa.
I'm gonna.
Anna, I live on a
taking you off
ranch.
the screen
I live
and
on a
you can
ranch.
come back when you had the hat. Al, you've been very patient. What have you got to add here?
Oh, no, I mean, there's just a few things that I was scanning that deck as you were going through it pretty quickly. So one thing, though I know it's a small market, the veterinary market is growing immensely in the United States and globally. It's an easier entry to the vet space from a regulatory cost of goods, call points, so on and so forth. And since COVID, the U.S. added another 10 million cats, another 10 million dogs. Radiation oncology and other sorts of things are really on the rise. So you might want to look at that as an entry point and a proving point, and then you can still do it under, like, if you wanted design controls or whatever the case may be, and then roll a human. The other thing is I work with a lot of academic institutions as an advisor, and things I do with companies as well, but I always engage the regulatory experts early. I engage with the FDA very early. Everybody, I've worked with companies, huge companies, where they say, oh no, we don't want to talk to the FDA. Well, I sort of have the approach that, hey, I engage them very quickly. And really, they're there. They can be of great help to you. And I do it with professors from academic institutions all the time. I think that's important to do, to really understand your regulatory strategy. And then the last thing I'll say, and then I'll just shut up, is when you think about really fundraising, there's many aspects to it, but you've got to know what you want your company to be, right? Are you going to want to grow your company and really expand it into this material science company, or this one particular area? Can you see this technology as being a platform technology? It's not a one-hit wonder. It could be used by NASA for space travel, or whatever the case may be. Look at that. You could also get pretty nichey in how you license. You might be the supplier, but you have a dent supply in the dental world who's taking it for the licensing for the dental, and then you have something in the interventional radiology space, a company there that's looking to take it forward. And then I would also say look at as a little niche area, battlefield medicine out of Fort Detrick, Maryland. There's money there to be had. Most people think the military spends everything on weapons. Well, 18% goes into medical, and so there's a lot of things that are very important to them to be able to, provide the care that they need in the far forward areas as much as possible. And they're pretty good at funding things. So anyway, I'll just.
I'm sad to say, Anna, and I feel I failed you. This was supposed to be able to give you some clarity and linear thought, and I think we just made it worse. There's just so many ideas coming at you here that now you're going to get off the phone and be like, honey, that was an unmitigated disaster. I don't know what to do next.
No, it's great. I love it. It's, you know, it is a platform technology, right? That's exactly the problem, is figuring out, you know, as a startup, you have a thing and you need to get to a market, but you have to ignore all of these other markets. And I'm trying to figure out which is the biggest one, which is the
And how
best,
do you
what is
scale?
the easiest, what is going to have the best FDA regulatory pathway. You know, we were pointing out that the vet market has grown really substantially during pandemic is great, because I had initially written off the veterinary application because they tend to be an extremely cost sensitive.
You had a picture that looked like a hand, the gloved one that he was holding a bird's neck. What was that?
So that came from, well, I found that on the internet, but that came from a technician. This was actually one of the original ideas. Was a friend of mine was a vet technician describing wearing those big heavy leaded gloves and trying to hold a uncooperative patient, which can be a 150-pound Rottweiler. But this was a technician out in St. Louis who actually was describing trying to hold a kestrel wing open while taking the X-ray, but using those big heavy gloves, you know, it's really easy to re-break the wing. So this is one of the challenges that veterinarians have, that you in most states cannot have this picture would be illegal because you have unprotected hands in the X-ray. So the most
Oh, I see. All of those hands there are not protected. Mhm.
So you're X-raying your hands to get the picture of the patient,
Mhm.
but the many states, and again, it's very state dependent, really look down on, you know, forcing your technician to put their hands in the X-ray, right? Exposing your technician to unnecessary radiation. And it's gone as far as actually in New York State that if you're X-raying a horse, nobody else can be in the room because they've had so many issues with veterinarians and technicians just irradiating themselves.
Eddie would like to know that that's what got Marie Curie. Now, this is, I have to tell you, there's something very special about your presentation today, because Michelle Fleming joined Premium, I don't know, 9 months ago, whatever. I leave her little love notes, never responds. I say, hey, we've never spoken. Abject silence. This is the first time I've ever seen her on a call. And she had a question. And I was like, I'm going to put her on camera. I don't know what she sounds like. I don't know what she does. I don't know anything. So, Michelle, why are you here? What do you do? Introduce yourself to the group, and where the hell have you been, and why have you been ignoring my calls?
I'm busy. I'm blocking and tackling here in Dallas, Texas. Can you hear me okay? Great. Anna, thank you so much. This is interesting to me because we get calls all the time for cool, innovative, unique, new products to bring them to market, to manufacture. And I wanted to hear, you know, a little bit about, can you hear me?
Yes. Okay. Who are you with, and what do you do, and why?
Oh, I'm now with Repligen, and I was previously Spectrum Labs, and we were acquired in 2017 by a bio life sciences company, Repligen. And our part is a small part of Repligen. Repligen is now about 800 million. And we're small, doing our thing, making widgets, and we make products that help the surgeon do his or her job a little easier, if you will. A lot of equipment, protective drapes and covers, gamma probe drapes, a lot of robotic assisted surgery drapes, parts, pieces, that sort of thing. And we do orthopedic patient positioners. So I was just thinking about this, if I can ever help you with any advice, or any of my engineering team can ever help you, or our quality team can ever help you, we're happy to sign your NDA, of course, and you know, give you ideas. We work with textiles. We work with everything from soup to nuts, if you will, on the manufacturing side. And we're small here outside of Dallas, Texas, but you know, I work behind the scenes manufacturing for Medtronic, for Hill-Rom, for Boston Scientific, for J&J. So we're small, but and you won't see my name anywhere except on a CE mark label for sale into the EU. But it's exciting to hear about what you're doing. I came in a little late. I don't know the weight of the product. I don't know how you intend to sterilize. But you know, there's a class 1, as Michelle's talking about, but there's also class 1S, and it could be considered class 2 in some instances, depending on, you know, how long the product stays on. So, you know, it's super interesting. And if we can ever be of any service, or if you have any questions that my team could ever possibly help you with, we're happy to do that. Our engineers are always excited to learn and to help any way possible. So I just wanted to offer the resource to you.
Great. Well, thank you, Michelle. Thanks for
Yeah.
reaching out. Yeah, yeah, that's great.
Yeah.
So,
Yeah, I took
and
a ton of
I-
notes and
Yeah, I mean, I can help you any way along. One of the things that we do, and it helps me, it's almost a protection type of thing. I try to CE mark everything possible. All of our family of products are grandfathered in on the FDA and CE marked. It's considered surgical drapes, even if it protects a robotic arm that's not in use, it's still considered under the FDA as a surgical drape. So we go in and we work with partners, and especially Hill-Rom with the patient positioning products, and we hold the CE mark for them, and we help them navigate that path, because smaller companies like you, if you're bearing that risk, that's something you need to promote for yourself, that you're a low risk provider. And that's what I do in moving it forward. And it also helps the OEM customers stay with me for a period of at least 3 years time, because they can't take that CE mark very easily and go elsewhere and go, with another manufacturer. Just something
Michelle,
to
what you're
think
saying
about.
is
I know
very
it's a lot.
interesting, but I'm sorry to interrupt you, but I'm like, sorry, not sorry. Can you introduce us to Minnow there? I mean, we don't really care what Michelle said as soon as she walked into the screen.
yeah, she's a bit of a showstopper. This is Minerva.
Oh.
You say hi, Minerva? Hi. You wave hi? Yeah. She's 15 months and has a little
What's
bit.
that on your pajamas there, love?
Yeah, it's still early here.
What are the pajamas? What's the pattern there?
That is a clownfish.
Oh, okay. So like Nemo.
Yeah, off-brand Nemo.
It looked like her dad showed up there for a moment.
Oh yeah, well, I got the at 8 a.m. to 9 a.m. slot, and it's 9 a.m. So Dad's
So
now
what does Dad do?
Don't blame me. She just came up here on her own.
Dad, what do you do?
He's a software engineer, but he doesn't like that term for Apple.
He works for Apple,
Mhm.
but he's not a software engineer. He's kind of like one.
Yeah, what she said. He works for the advanced computation group, so he's more of a mathematician. Somewhere between. He doesn't work on a whole lot of user-facing products, but a lot of the stuff behind the scenes that I don't understand.
And Minnow, what do you do for a living? Minnow,
Oh, Minnow,
what do you do for a living, love?
she's cute for a living.
Okay. Your mommy's got to be rich.
But I'm still gonna make you work hard because that's the kind of family we are.
No.
Yeah, I'm afraid all the questions I had, I don't even remember what we were talking about now. We just want to play.
I would put her down and let her walk away, but there's a dog lurking here, and dogs and baby and food are a very politically charged
Are you
topic.
saying that you're afraid she would be eaten?
I'm afraid that she would be licked clean and harassed by a dog.
There are worse ways to go.
Yeah, I've got it.
Sweet.
See, I've got a dog here too. Say hi, Oscar. No, okay.
Thank you, Michelle. Don't be a stranger, okay?
Thank you. Anna,
Mhm.
I'm going to make sure you have my email address just in case we can ever help you with any questions along the way. I think
Come
what you're
on,
doing
love.
is super cool and super important. Thank you.
Yeah,
Slack. I've already connected you guys on Slack. It's a thing.
Great.
Yeah.
Thank you.
Uh-huh.
all right. Well, thank you so much, Joe. This has been fantastic.
Whelming?
Well,
Joyful?
insightful. I really appreciate everybody here's got a unique insight into it. I
That's what
definitely
makes it so fun.
yeah, and I'm glad I could provide something to think about. Oh, come on.
Yes, you definitely entertained us today. And you educated us.
Yeah, well, I'm hoping at some point you guys are going to start seeing these everywhere. Like I said, I really hope to put everybody else out of business in this.
Well, I'm hoping soon that you see all of these people everywhere. You'll see them at 10X, and I think you have a lot of follow-up conversations to have.
It'd be great to see, honestly, anybody at this point, just everywhere.
Just to get out of the house.
Get out of the house.
Okay, so I don't know how big your place is, but maybe we can all have a road trip and just descend on your place next weekend. Or maybe for Thanksgiving, if anyone doesn't have plans, go to Anna's house.
Proof of vaccination, and you guys are all good.
Fair enough, fair enough. Okay, everyone, thank you so much for helping Anna, and we'll see you next week. Thanks, Anna.
Thank you guys so much. It was a pleasure.
Bye, Oscar.